as national, state, and selected local area vaccination coverage among children aged 19 to 35 months for the United States, 2013. First, we're going to talk about a little bit of background information about vaccines. We've come a long way since Edward Jenner created the first vaccine for smallpox in 1798. For children born between 1994 and 2013, being vaccinated will prevent approximately 322 million illnesses, 21 million hospitalizations, and 732,000 deaths over the course of their lifetime. According to the CDC, it's better to prevent a disease than to try and treat it. Vaccines activate a person's immune system by exposing them to the antigen, usually a weakened or killed version of the virus, so that they can develop antibodies without having to risk getting sick. It's considered safer to have a child's first exposure to a virus through a vaccine where it's weakened or dead than encounter it out in their environment where they actually risk contracting the virus. Inherited immunity, which is where it's passed from the mother to the child, is shorter lasting and weaker than acquired immunity, which is from exposure, which is why we want our children to be vaccinated instead of just relying on the mother's immunity. So the recommended vaccines for children aged 19 to 35 months, according to the CDC, from birth to 35 months, is hepatitis B, rotavirus, DTaP, which is diphtheria, tetanus, and pertussis, HIB, PCV13, which is pneumococcal conjugate, IPV, which is an inactive poliovirus, the flu, MMR, or measles, mumps, and rubella, varicella, which is the chickenpox, hepatitis A, and for certain high-risk groups, meningococcal vaccine is also recommended. The study we looked at used data collected from the National Immunization Survey and the Council of American Survey Research Organization. There is more information about how they collected this data and their methodology on the websites listed. The data was considered statistically significant at a p-value of less than 0.5, and the data was collected through random call surveys to cell phones and landlines of households with children aged 19 to 35 months, and then there was a follow-up survey mailed to the vaccination providers after the parents give consent. So you can see a table with the confidence intervals and percentages for national vaccination coverage for 2013 and the 4 years leading up. So coverage remains stable relative to 2012, except for an increase in the hepatitis B birth dose, which increased by 2.6%, and rotavirus vaccinations increased by 4%, and hepatitis A vaccinations increased by 1.6%. The percent of children receiving no vaccines remained below 1%. In this case, for 2013, it was 0.7% of children. Vaccines achieving a greater than or equal to 90% coverage rate, which is the target rate for the Healthy People 2020, was 1 dose or more of MMR, 3 or more doses of hepatitis B, 3 or more doses of the poliovirus vaccine, and 1 or more dose of varicella vaccine. So these are the vaccines that actually met their goal. Vaccines that did not meet their Healthy People 2020 goal of greater than 4 doses of Tdap, greater than 4 doses of PCV, or the pneumococcal conjugate vaccine, the full series of the HIB vaccine, more than 2 doses of hepatitis A, rotavirus, and the hepatitis B birth dose. Now you can break down the vaccination coverage for the nation further by looking at demographic characteristics, which is this chart here. Children living below the federal poverty level had a lower vaccination coverage than those living at or above the poverty level. The biggest difference was found in the DTaP vaccines, which was an 8.2% difference. The HIB vaccines, which was a 9.5% difference. PCV vaccine with an 11.6% difference. And rotavirus vaccines with a 12.6% difference, and hepatitis B. Another demographic, the American Indian, Alaskan Native, and Asian children had higher coverage than white children for more than one dose of MMR and more than one dose of varicella. They had American Indian, and Alaskan Native children had a higher coverage for more than 3 hepatitis B doses than white children, and Asian children had a higher coverage than white children for more than 2 hepatitis A doses. Black children had a lower coverage compared to white children for more than 3 to 4 doses of DTaP, the full series of the HIB, more than 4 doses of the PCV, rotavirus, and the combined vaccine series. After adjusting for poverty, the differences were reduced for Black versus white children, but it was still statistically significant, except for the combined vaccine. And then Black and Hispanic children had a higher coverage than white children for the hepatitis B birth dose. You can also break down vaccination coverage by state. So there was a large difference between the different geographic locations. For more than one dose of MMR, it ranged from 86% coverage in Colorado, Ohio, and West Virginia to 96.3% coverage in New Hampshire. More than 4 DTaP doses ranged from a 74.3% coverage in Arkansas to a 93.3% coverage in Massachusetts. The birth dose of hepatitis B ranged from only 44.8% of children being vaccinated in Vermont to 88% in Kentucky. More than 2 doses of hepatitis A ranged from the low rate of 33.6% of Wyoming's children to 72.1% of Connecticut's children. Rotavirus vaccine ranges from 56% in Arkansas to 84.4% on the high end in Rhode Island, and the combined vaccine series ranged from 57.1% in Arkansas to 82.1% in Rhode Island. So Arkansas is on the lower end for 3 different vaccines. And then the sources for our background information and the source for the article itself. All right, thank you.